Hi, I'm Dr. Peter Liu. Together with Dr. Yihui Zhang, we would like to welcome everybody to this special presentation on the topic of personalized care of patients with heart failure and the results of this international survey on patients' needs and perceptions. And it's a great honor for me to actually share the podium with Dr. Zhang, who's from Fuhai Hospital in Beijing. And she will be presenting the data, and I will make comments after a certain number of presentations. Thank you very much, Dr. Zhang. Please go ahead.
Thank you for your introduction. It's my great honor to introduction the result of this survey. Totally about 98 patients from the 18 countries to join in this survey, and the age for the patients that we can see, more than 65% have the age more than 55, and the male patients accounts for 61%, and about 18% live in the rural area, and the about 66.7 patients complete the second post-secondary education.
Yeah, so if I can make a comment, this is really actually a very broad global survey involving 3 major continents from Europe, Asia, and North America. And we do have representative population, particularly in terms of location. But however, the patients are better educated. And I'm glad to see that there's more female patients represented as well. Thank you.
So how the heart failure history, we can see 7.4% and 54% and 12.5% patients have the heart failure history less than 1 year, more than 5 years, and more than 10 years respectively. Nearly 55% have the blood pressure, hypertension, and also other the blood vessel disease and heart rhythm disturbance, and well disease, kidney disease, lung disease, and also the diabetes.
This is a very typical of patients with heart failure with a number of comorbidities, and particularly notably high blood pressure, diabetes, common risk factors. And it is true that they have fewer blood vessel diseases, likely because of the fact that these are relatively stable patients with better controlled conditions.
So this is objectives for the patients. The most is the prolonged life as possible, and also hope to live a normal life and live independently, and reduce the hospitalizations and reduce symptoms. Also improve the physical activities and improve the quality of life.
Yeah, this is a very important slide. It really actually shows patients interested in terms of the balance of the goals of prolonged survival, and also in terms of reducing symptoms, improve quality of life. It's really both of those parameters being important. Interestingly, in terms of reduction in hospitalization, it's not so important for the patient, even though for the doctors, this is quite often a very important metric.
So this is the symptoms to influence the quality of life. It ranked use the cumulative scores, and we can see the first is fatigue, and also the short of breath, and also the swelling, and also the last is the lack of appetite and nausea.
Yeah, so I think this really actually reflects the challenge for the patient who are on a lot of medications, but they are relatively stable. So really feeling very fatigued and some shortness of breath that limits their ability to exercise and to do activities, and reflected in earlier slide. But they're generally fairly well treated, so that the swelling, etc., are better controlled.
This is the result of the pills of the heart failure patients. We can see the average number of the pills in a single day is 9.3. And for the heart pills is 6.2, and the average times for the heart failure patients to take medications, the mean times is 2.5.
Yeah, this is really confirms, what the patients always tell us. They're taking too many pills, and the patient with heart failure are really burdened with a lot of pills taken many times a day. And so this is represent a real world challenge for the patients.
So this is the non-compliance for the medication for heart failure. There is a lot of reasons, such as forget to take medication and cannot afford, and also do not like the feel, or others such as to want to reduce the doses, and also to do not take too many pills.
So these are common stories that patients tell us, are very much reflected here, in that because of the number of pills and the possibly side effects, the patient really actually feel the burden of taking many pills. And this also reflects some of the reasons in which they may stop taking the medicine or being non-adherent to the medications. So this is a real world challenge.
So this is the times to see the cardiologist or heart failure nurse. The mean time is 6.7 and 2.2 respectively. So for the average time to see the non-cardiologist is about 2.1. And that also shows nearly about for the general practitioner or family physician, the average time is about 2.7.
Yeah, it shows again that the frequency of seeing cardiologists is much higher than the other health providers, and may represent an opportunity, to improve the care for the patients.
So for the urgent care visits, that shows nearly 35 patients have more than 2 urgent care visits in the last 12 months, and the average time is 1.5. So for the patients who make the remote or the telemedicine consultations through with the proportion more than 40% accounts for nearly 28%.
Yeah, this is very interesting. It suggests that even though these patients are relatively stable, they still end up, having periods of deterioration, and that the telemedicine is used more could be related to a pandemic, but also the fact that if the patient is stable, this is actually a good way in terms of maintaining communication.
So the next is about the satisfaction survey result that shows there are also nearly 8% of patients that hope to have a more frequent appointment with cardiologist, with heart failure nurse, and also to have more discuss on the symptoms and the treatment.
Yeah, this reflects the earlier data. In fact, that the preference is to see a cardiologist or a heart failure nurse to look after their condition.
And another satisfaction survey results show that nearly 70% of patients hope to get more information for the disease consequences or the prognosis, and also more information for the treatment.
Yeah, this is very promising in that the patients are very interested in their condition, wants to know more about it, and that shows that they would like to be partners in the care of their condition rather than just a passive recipient.
Yeah, so for the how the important for the following aspects for the relationship with healthcare, that shows the patients will need more advice on the diet, lifestyles, and also more explain for the test result, and also to learn about more the symptoms, and also the hope to evolve to the treatment decisions.
Again, very positive type of information suggesting that the patients really like to be engaged, they like to learn more, and then they like to share in the decision about their treatment.
Okay, so the last is about the sources of information that the patients hope to get. So we can see the first is also hope to get the information from the cardiologist, then also others such as the general practitioner or heart failure nurse. And the last is from the mobile health applications.
Yeah, so it reflects again the wish for the patient to actually see the cardiologist or the heart failure nurse more often. But of course, we can see that there are limitations for this. But I think the opportunity is that we can actually provide information in a variety of fashions so that patient can actually access them depending on their preference and depending on their opportunity.
So would you please to give the conclusion for this survey?
Yeah, so I think this is a very exciting survey, which is anonymous, but involve patients from around the world, and is co-developed by 15 heart failure specialists and 4 patient representatives as well. And ultimately, the answer came from 98 respondents in 18 countries. So it's a very important global effort reflecting insight into patients' perceptions on the burden of heart failure and their expectations. And so this is really actually a very rich data set to allow us to begin to design appropriate educational tools customized to the patient's needs and prioritized according to patient-centered education program to satisfy their needs and to improve the care of their heart failure.